The following content is for informational purposes only and should not be considered medical advice.
Welcome to KC Wellness Talks. I'm Dr. Dawn Ipsen, pharmacist and owner of Kusler's Compounding Pharmacy in Snohomish, Washington, and Clark's Compounding Pharmacy in Bellevue, Washington. KC Wellness Talks brings together a diverse group of practitioners and doctors and healthcare advocates with the goal of addressing prevalent health concerns in our communities. Our discussions will focus on practical solutions ranging from simple home remedies to cutting-edge technologies and treatments, aiming to empower individuals and overcome these concerns. Today, I am really pleased to introduce you to a longtime friend, Dr. Paul McBride. Dr. Paul McBride trained at the University of Utah and also National Institutes of Health, or NIH. Throughout his career, he's received many glorious opportunities of all types of medicine, including emergency medicine and internal medicine. And in addition, he is board certified in allergy and immunology, and he has been practicing at the Everett Clinic in Everett for 34 years now. He enjoys collaborating with individuals facing challenging medical concerns and complex cases, and he prioritizes patient well-being and excels in actively listening to concerns while offering informative guidance and potential solutions. Dr. McBride, welcome.
Thank you.
My very first guest.
It'll be wonderful.
We're going to have a good time today,
We're going to have
we?
a good time.
You and I have worked together for a really long time.
I tried to figure out how long it's been, but I can't even remember before.
I know, right?
It's been so long. It's like,
Yeah.
I just don't remember my practice without you. So that's the
Aw.
hard thing.
Well, it's been, I think, my entire time that I have been at Kusler's Compounding Pharmacy.
It
So
has.
21 years according to my calendar.
That's a pretty long
But
time.
of course, we still look like and act like we're in our 30s, so who knows the difference?
That might be in base 20 instead of base 10.
Okay, I have a very important, serious question to get you started and to
Okay.
ask you. So tell me about the coffee mug that you brought with you today.
My Stevens Pass mug, that's sort of my happy place. When I first came here, I had trained in Utah, so I did a lot of skiing at Snowbird. And I came here and I just was really sad about the snow. And my brother-in-law got me connected to the Stevens Pass Ski Patrol, which was my happy place for a long time. And this just reminds me of life outside of work.
Very important to have that as well, right? Otherwise,
Yes.
all we do is work.
Yes.
Yeah, so that's great. And how long have you been skiing then?
I've been skiing since I was 15, so that's a long time. That's 55 years.
Right? And still going strong, and you used to do ski patrol and all those things.
Yes.
Yeah.
And, not as strong as I used to since I crashed and tore my quadriceps tendon, but I'm still out there.
Yeah,
So.
you got it rehabbed and back at it. Yeah,
Yeah, mostly.
mostly.
I am old.
Yeah. Well, my mug today is a very special mug, mostly because it was a gift by a very dear friend. My mug has a prescription on the face of it, and it is my prescription for coffee. It says, lift mug to mouth, sip repeatedly until awake and alert, and daily grind 15 ounce. It's a big size mug. That's probably 2 cups there.
Yeah.
And as many as you need, so I love that it has refills approved for me. Yeah.
Being the pharmacist that you are, I have to approve refills.
I know, yes, we must. We
That's
must
right.
do everything by the book.
Yes.
Yeah. So let's see. Should we start with like where you and I first started working together?
That was here.
Okay. Yeah, we did it here. And it was a lot on sinus stuff.
Yeah, a lot of weird things for sinuses.
Yeah.
I somehow got roped into the sinus world because I know how to treat sinus disease because my mentor at the NIH really liked sinus disease for some reason. So he taught me, and then I needed help with people that were resistant to everything, and that's where I met Dawn.
Right. And I remember back when you would call with ideas and thoughts about what you were seeing, I remember you pushing me to go dig into Mayo Clinic research quite in depth. Yes?
Mucoblast.
Mucoblast. Yep, that was one that you brought to me. You'd already created that. But
Oh, I tried to create it, but then
Yeah.
we had the wrong pH and we almost killed ourselves.
yes, a pH of 2 in a nasal spray is not something that feels very nice. But
Correct.
Mucoblast was the name coined for the mucolytic nasal spray that we first worked with, which
Yeah.
was, still is, we still compound it, Quite a bit.
Yeah.
N-acetylcysteine, mupirocin, and budesonide.
Correct.
Yeah, okay.
Still works.
Still works to this day. It breaks up mucus, gets it out. Yeah. What's pretty cool too is, I don't know if you knew this, but it's something that has been talked about, and patients tell patients, enthusiastically satisfied, right? So I literally get phone calls from doctors and pharmacists in pretty much every state in the U.S. saying, what is this nasal spray and how do we make it and what is it? So
Yeah, it's funny. One day Dawn told me that I wasn't the most popular prescriber of this fake nose spray that we invented. And she told me that everybody was using it. It's like, cool.
yeah, it's pretty cool.
Yeah, I like that.
You're making a difference throughout the nation.
Yeah.
Yeah.
A very small difference throughout the nation.
It's good. It's all a difference. You're impacting patients.
Okay.
Yeah. Then from there we went to Beta Blast.
Beta Blast. That was a bust. That didn't work near as well as Mucoblast.
Yeah, but we still see it because, Beta Blast is itraconazole, budesonide, and beta-glucan.
Well, that was mostly for a lady at the hospital who was a nurse and ended up with a fungal sinusitis that we needed to figure out how to treat.
Right.
And it worked as well, but it's not as useful as the Mucoblast was because
Yeah.
it's not as common a problem.
Right, I agree. Yeah. Mayo Clinic did have some info on how do you know it's fungal or not? And I remember first working with amphotericin, we'll call it, but amphotericin, every pharmacist knows of it as amphotericin. But,
Every doctor knows of it as amphotericin too.
Right? Shake and bake is the side effects when it's IV. Yeah.
As long as you don't like your kidneys, it's a great drug.
Right. Yeah. But yeah, so the problem in a nasal spray is it just does not stay potent. I think on best we got 21 days of potency out of it, so we had to switch antifungal. It just didn't work. Yeah.
And that's where Dawn works her magic because she knows pharmacokinetics better than most of the people who trained me. So she would say, this isn't going to work. And then usually she was right. So we had to switch to something else.
Yeah. Well, Sinus was fun to start with. I feel like it's where I cut my teeth and completely built trust with you. So thank you for those opportunities.
You're welcome.
Yeah. And then now, we still do Sinus, but talk to me more about what you're seeing now in your practice and what are you seeing and what drives you to go, oh my gosh, we got to talk to Dawn.
Well, what I see now mostly is refractory rhinitis, and people don't realize how many different things can mess up your nose, and your nose is almost all your nasal symptoms are controlled by your nerves. And as we're getting more and more data that we can actually understand, where there's a phenomenon called neurogenic inflammation, which is basically the nerves controlling secretions, drainage, and swelling, congestion, and they're different nerves with different neurotransmitters. And once you access that, then that's been really helpful because then you can help me block all these things. The drawback is we don't know which one to block first.
Okay.
So it's often hit or miss at the beginning until you figure things out.
Wow. So these patients are coming in, usually with symptoms like runny nose that won't stop. They've probably tried and failed every antihistamine on the market, probably.
Most of them, yes.
Yeah, what else is sort of a telltale sign that you're like, I'm going to think neurogenic inflammation, or I have a suspicion that this might be where we're headed?
Well, I usually get the benefit of listening to everything that's failed. So when you realize that everything they've tried has failed, you realize, okay, that's not going to work, so we have to come up with something else. But as you get into the rhinitis literature, you have a phenomenon called gustatory rhinitis, which is a huge increase in nasal secretions when you eat. It doesn't matter what you eat, it's just physically eating. Then you have your nose running when you go out in the cold, and then you have your nose running for lots of different other reasons. And you realize that it's all controlled by the vagus nerve, and the vagus nerve has lots of functions in the body, but the nose is incredibly richly innervated by the vagus nerve, and that controls all your secretions and blood flow and congestion. So that's where the neurogenic inflammation idea sort of came from. And I was introduced to that at the NIH 37 years ago, but then the literature hasn't really gone very far since then. So it's still out there, and we're now accessing that information and trying to use it in a hopefully positive way.
Okay. So you're cutting edge still in just a little different realm of it, in the sense of, this isn't, it doesn't sound like it's very well defined yet on what do you do about it once you know it's there.
Well, it's at my usual timeline. I learn something, and then 30 years later, I apply it. That's about my usual speed for things. But this whole thing, neurogenic inflammation, is really fascinating because when you're not allergic and you're not infected and you don't have other triggers, you still have symptoms. So it's sort of by default, this has to be the cause. And the vagus nerve is now what we realize is what controls every aspect of the body. And whether you want to think about it or not, your nerves control all your functions through your hormones and through the nervous system.
Okay.
So literally, this is the next step in noses, is how do you access that? And now that we can look at neurotransmitters differently, we can actually figure out which nerves are causing what.
Whoa.
And now we have some pretty effective medications that can modulate those. So a lot of the diseases people think about, like IBS, is literally a neural innervation issue in the bowel.
Oh, wow.
And if you can block these vagal nerves, then you can actually control bowel function, and whether it's diarrhea or constipation. So you don't usually think of noses and bowels in the same thought.
No,
but
definitely not.
They're both controlled by the vagus nerve.
Okay, that's fascinating. So that means that there is, some glimmer of hope or yet another pathway that maybe a patient hasn't investigated yet that could give them a better quality of life.
Absolutely. And
okay.
I remember one patient from Snohomish. She was a very interesting woman, had a horrible stroke, and the only thing she and her husband could do together was go out to eat.
Oh.
And her nose would run so badly that she was embarrassed to go out to eat. And he would help her from her wheelchair to the table, and then she just was so embarrassed. And finally, we tried atropine in her nose, which was, again, not something you would normally use atropine for. But she could eat, and she could do it, and she was elated.
Wow.
Unfortunately, it only lasted till she died a few months later, but at least we gave her a little bit of time to enjoy herself. And it made me feel good, even though it wasn't really the best choice, but it actually worked. So that was sort of my interest, like, wow, that really worked. And now we got to find something better and safer than atropine up your nose.
Right, yeah, okay. So let me ask this then. I know in the pharmacy, I commonly have patients come in and they complain of their nose running and things like that. But have you seen a correlation to what age of patient or gender of patient or like anything that sort of not necessarily classifies that, oh, it's going to be that, but any correlations in that?
Well, allergy is usually a young person's disease,
Okay.
unless you change climates and you move from like Arizona to Seattle or vice versa. So typically as you get older and older, the thing I see the most correlation with is women that are peri or postmenopausal, and then they start having, quote, allergies. And it's very unlikely for you to become allergic at 55. It's not impossible, just unlikely.
That's true.
What's very likely is for you to become hormonally fail and your estrogen stops. So what most people don't realize is that your estrogen level runs a woman's life from the age of menarche.
Okay.
And they make a little bit of testosterone as well, but the estrogen overwhelms the testosterone. And as they get older and their estrogen disappears, then all of a sudden their testosterone is actually much more important. And that causes a lot of interesting problems for women as they get older. But in terms of noses, estrogen is a huge trigger for allergy cells. They're actually very hormone sensitive, and that's why people with allergies will often have marked flares at the time of their period.
Okay, all right, that makes sense. Prostaglandins are releasing like crazy and inflammation increases like crazy, and the whole symptomology is just on fire.
Correct, and it's all controlled by the vagus nerve through your hormones, and that's the thing. So that's the difference.
Okay. So that kind of drives into where you and I still work together, where it seems like from the number of women I get to speak to that you
that I send you.
You get the privilege of this is in your office almost every day. These types of patients and these symptoms.
Clearly every day.
Clearly every day. Yeah. Okay. How do you think they find you?
I sometimes wonder because they come from pretty weird places, but I think it's word of mouth. When people are miserable, they like to spread their thoughts around, and then I find myself in some of those catch basins one way or another. And then a lot of older patients like doctors who will just listen to them. They don't want somebody who's going to start typing on a keyboard and start prescribing things before they're even done with their history. So I think that's another place. But I really think my best advantage is I get to see what hasn't worked. So there's no point doing things that didn't work before because they're probably not going to work again. So that sort of pushes me right out into this. And the patients self-select more than you would think. They pretty much know that nothing else has worked, and they hear, oh, here's something different. So that's where I get involved.
Yeah.
And make your life difficult.
Well, not difficult. You keep it very interesting. Yeah. So what he's referring to is often you will see these patients, you will have high suspicion and proof even often that this is hormonally linked. And then I get to spend time
fixing it,
talking to them and doing the hormone history side of things and assessment of risk versus benefit versus appropriateness. And then I will generally make recommendations back to you of a yes or a no, or dosing or follow-up, and then away we go. And patients will get the opportunity to try hormone replacement therapy and see if it makes an impact on this other symptom that's not a hot flash, it's not a libido issue, it's not a bone issue, it's not anything else but
a nasal issue.
A nasal issue, yeah.
Yeah, it's an interesting thing. So I get to identify them, I get to work them up, Dawn gets to treat them, and then usually I get the credit for making them better, which is sort of a sweet deal for me because she does all the work and I get the credit. But it's been a very good symbiotic relationship for me having Dawn around because she understands the hormones better than I do by far. And then she's got the time and the staff to help her manipulate these people. I just need to get them to her and let her figure out their hormones, and then usually they get better.
So basically, it works out that I kind of get to do some of the heavy lifting to make your job within your practice a little bit more streamlined and easier so you can see and talk to more patients and get more people help.
Well, I think in women talking to men about their hormones, it's a lot easier for a woman to talk to a woman about their hormones. And I try and build you up pretty good before they get here and say, listen, Dawn's nickname to me is the Wizard, so she fixes a lot of cool stuff. And I think the patients, when they come here, they're expecting to be helped. And I think that's why they're super interested in what you have to say. Because I pretty much tell them, she's going to fix you, I'm going to write the prescription.
Yeah.
And then they're like, okay, that's pretty cool.
Yeah.
And and this has worked so well for so many people. I don't know how many letters I've gotten back from patients. I forward some to Dawn, but I mean, there's some pretty tear-jerking letters like, you saved my life, or you saved my marriage, or my kids don't hate me anymore. It's actually very interesting to hear what hormone failure can do to some women, and their lives are just ruined. And being a male physician, it's hard for me to understand that. If I hadn't seen it so many times, I really wouldn't appreciate it, but I see it all the time.
That's fascinating. Yeah, it's really pretty cool. And so, I mean, I think you know my process, but I'll just tell everybody what it is we do. So
you need to tell them what you do. They
tell
know
them
what I do. Yeah,
well, you're the magic, if you ask me. But yeah, so they'll call in, and my staff takes their demographic information, and they pay the fee, and then they get emailed a link. And what I learned in COVID is that I didn't have to make these people come to me and sit here in this pharmacy with me.
In this little room,
in this
right
little
here.
room that we're in right now, in our little studio. So the magic of Zoom was created with COVID, and we all got pretty used to it. And there's advantages and disadvantages, of course, but the one thing I require in our Zoom meeting that I do with them, which takes an hour, it's an hour-long meeting with me, is cameras on. Because I want them to feel like we are in the same room, and it just helps for communicating. I get unspoken subjective information too. I get to see what the environment looks like and what they look like, and are they dealing with weight issues or other things that might be contributing to the problems that you're describing. It also gives me the ability to be a really good pharmacist in the sense of when they were coming into the pharmacy, even if I said, please just bring with you everything you take, they wouldn't. They'd bring me an Everett Clinic list or a doctor list, and half of it wouldn't be exactly right, or it would be how they were told to take it, but not what they're really doing. So when I do my med reconciliation, I actually tell them first, hey, next we're going to talk about everything you're taking. Go ahead and take a minute or two and get up and go gather everything and bring it back. And I just sit there calmly and wait. And then we go through it.
Well, the nice thing about Dawn is I think Dawn walks a very interesting line between naturopathy and conventional medicine. And she's the only person I know who's actually successfully walked that tightrope because everybody else falls onto one side or the other. But somehow Dawn stays right in the middle. And I've not figured that out. But I don't know how many people teach at the University Pharmacy School and at Bastyr. I don't think there's a lot of dual speakers for that. But Dawn has an interesting way of getting things out of people that no one else can get out of them. And I have a nurse named Cheryl who can do that too. She'll tell me things about the patient that I would never get. And then that gives me a lot of hints. But she's been with me for a long time. She's a remarkable clinician, even though she's only a nurse. She's way smart.
Well, I would say she is the nurse because, I mean, she is. She's incredible.
Yes.
Not only as a human and being able to have a way to relate with a patient very, very quickly, but just her talents and expertise and her knowledge is incredible.
And when people are comfortable, they're willing to open up and talk to you. If they think they're being
Judged,
berated or judged, or that they're going to close up right away.
Yeah.
And when you give them a sense that we really want to help you, but you need to help us, then that sort of opens up a dialogue that I don't think very many doctors today get with their patients.
Yeah.
I think they're too worried about time and computers and all the things I don't like about doctor visits, which is time and computers, and then you have the time because you make the time. So I think that it's sort of almost a circle of trust that when they meet you and I, it's like, okay, this is the three of us.
We are the
deal
team.
with this. Yeah.
Yeah.
And I hear that all the time. It's like, oh, nobody ever asked me these questions. I said, that's why I sent you there, because she knows what questions to ask.
Yeah.
But that is your knowledge of hormonal biology is incredible. So that's what I take advantage of.
Well, I'm glad you take advantage of it because I find it really professionally rewarding. And
most of the time, we've had a couple of blow-ups.
well, but the blow-ups are okay too. It's just people not at that point really in their health journey, right?
Yeah.
Or
Expecting too much.
Yeah, different expectations. And I do think we do a good job of setting the expectation of we're not always going to make every single hot flash in the world go away.
Correct.
But if we can moderate and if we can temper all this and improve overall quality of life, wouldn't that be fabulous? And I think we're quite successful in that.
And this doesn't just pertain to noses and hormones in women. I mean, this neurogenic inflammation goes way farther than that. So if you know how to do it, you can actually block a sunburn from occurring. I mean, you just have to know how to do it because the burn is mediated via prostaglandins. So if you go out in the sun and you forget your sunscreen and all of a sudden, oh my gosh, I'm going to be burnt to a crisp, and you take the right medicine within an hour, you can actually block the entire burn.
Really?
The drawback is it doesn't prevent you from getting cancer. It just makes you not burn. So, but these are things that people just don't know. They're all manipulated by the nervous system through chemicals and hormones. And you can actually manipulate that really well if you understand it. And we're just starting to understand. That's the sad part.
It is true that it's the sad part because we're decades in on the knowledge of this is important, yet here we are.
And now we're struggling with something I learned 36 years ago. It's finally coming out. So that's sort of interesting.
It is interesting. Well, what's next for us, do you know? Where do you think we'll
I don't know. It might depend
research
on Mike. Might depend on Mike and Sue. What's next for us? If they, after they look at this video, our spouses may kick us out.
Our spouses may determine the next level of where we go.
No, I think the next step is we'll probably continue to delve into these weird things that nobody else wants to deal with, and I just have to decide once I retire whether I want to just keep my hand in this. And I've actually thought about just doing this with you, getting out of my regular job.
Yeah.
I don't know if that's true. It would really be rewarding or not, but somebody's got to deal with this because nobody is, and
that's the
you're
deal.
their last resort in a lot of situations. It's you.
And you're one of those really unique, extra special providers that has the knowledge, the training, the passion, and is willing to take the time at the same time to make it all come together. So that's pretty cool.
The time is the hard part because that's what they take away from us now in medicine is they take away our time and make us do more things.
Right.
But there's an interesting surgery for rhinitis with nerve causes. There's a surgery called the ClariFix procedure, CLARIFIX.
Okay.
And what they do is they find the vagal nerve entry into the nose through the nasal nerve.
Okay.
They identify that with a fiber optic scope, and then they freeze it with liquid nitrogen like you take off a wart.
Wow.
And if that works, you can stop this runny nose from vagal stimulation. It's actually really cool.
Wow.
So you can do it with our lotions and potions, but
Yeah.
if the surgeons can find the vagus nerve, they can actually do it with liquid nitrogen, and it's one and done.
And do you think that would end up being like just a simple in-office procedure, or how?
It
is.
You have to have an
Okay.
endoscope, so
Okay.
your office has to be specially equipped, but it is
Right.
in the office. They never go to the OR.
Really?
This is an office procedure. It takes about 15 minutes in the right hands, which means in my hand it would take an eternity. But in a surgeon's hands, it takes about 15 minutes, and it's fantastic how it works.
Wow.
But you have to make the diagnosis, and that's the
Okay.
difference.
And so, could you subjectively make the diagnosis in the sense of these drugs work, therefore it is, or is there an actual test?
Well, no, it's what you referred to first. Is
Okay.
you have to take a history. You have to make sure they're not allergic. They're not infected.
Okay.
They don't have gastric reflux, and it's no other obvious cause. And then you'll put them on an anticholinergic nasal spray, like ipratropium or Dymista equivalent, or one of those. And then if they get symptom free, their choices would be, oh, I'll just take this nose spray, or I'd like to try and get this frozen and be done with it.
Right.
And it's actually really neat when it works, because they are literally symptom free.
That's incredible. And symptom free pretty quickly, it sounds like.
Like instantly.
Wow.
Because when you freeze the nerve, it can't transmit any more signals, so it's pretty much done.
Wow.
But yeah, again, the power of the vagus nerve, and people don't realize you have this parallel nervous system, which is just the vagus. So you have your conscious nervous system and your voluntary nervous system, and then you have the autonomic nervous system. And that's the fascinating one, because that's what controls everything, but it's controlled through your hormones and through your nerves, and then the vagus does the work. So if you can access that, so all these drugs we're seeing now in COPD and asthma and runny noses and pain, I mean, you're seeing that the nervous system is in control of the entire process. So if we can access that and figure out what neurotransmitters are involved and what nerves are involved, then we have open up different treatment options for people, and the less people have to deal with, the better. So if we can make their lives better, then they can enjoy things and they don't have to fuss with things.
Right.
But it's a slow process, and what's exciting is nowadays with medicine, you don't have to learn, what a cell is, because you have a book that tells you that. So the kids today can start from where we are now and then go forward.
Oh, wow.
And that's why I think that knowledge and human knowledge is expanding sort of exponentially now, because people don't have to learn from the beginning. They start somewhere and then they just add to that.
That's
so it's
cool.
pretty cool. And I think medicine, I'm really hopeful that medicine is going to have some of those same breakthroughs, but it's a lot slower in medicine than it is in regular life, because the FDA has to check everything 10 times before they let anything go, and that sort of slows things down, but it protects people at the same time.
Right, that is true. Checks and balances, safety first, but
Yeah, but somebody has to have the ideas. So they have to have the people that are out there in the front willing to get their hand slapped or their nose broken, depending on the circumstances, and then see if it works. And then all of a sudden you get somebody's attention. It's like, hey, this can be used for this. And then it just sort of blossoms from there. And now, I mean, you see the medications that we have options on today. I mean, they can do all kinds of cool things, but it takes 20 years to get those drugs from insight to market, and then the drug companies don't make it cheap, so then we're stuck. And that's what you can help me get, is drugs that are not available in the United States. You can compound them here, and they're available everywhere else, and for quirky reasons they're not here, like ketotifen. I mean, here's a drug that's available in every country in the world, and it was a squabble between the company and the government that prevented it from coming into the US. So it's like,
it's fascinating, and you're right. We do, compounding pharmacy, ketotifen is something we compound like every single day.
An amazing drug, and it's incredibly safe, but the FDA and Sandoz didn't like each other, so it never got approved in the United States.
Right, interesting.
Except as an eye drop. It is an eye drop.
Right, that is true, an eye drop, but to be able to have it in capsule form, and he's talking about a drug, ketotifen, that works as both an antihistamine and a mast cell stabilizer, and primarily used for its mast cell stabilization process.
And a steroid and a leukotriene receptor antagonist. So it has like multiple different functions, and it's a huge option for us, but not available unless you run into a pharmacy compounding person like Dawn, in which case
Right.
you have access.
Yep. Access and ability and technology and interest. That's true.
And the
Yeah.
energy.
Yeah.
This pharmacist, Dr. Ipsen here, has more energy than any 3 people that I know added together. And when
I
you
don't know
see
about
her flying around her office, doing 10 things at once, you realize, wow, that's pretty cool.
Yeah, well,
We do have a mutual admiration.
I was going to
society
say,
here.
yeah, we have a mutual admiration to society because I know you were the same way, that your brain is always going and spinning and turning on new things and ideas and working really hard.
It just doesn't always go in the right direction sometimes.
I don't know about that.
It spins. That's a good term for it.
We
spins.
spin.
Yes.
Yeah, at least we don't fall over when we spin. But yeah, any closing thoughts before we end it today?
I think as a doctor, what I would ask you as a patient is to write down your thoughts and try and logically organize them. Because what's very frustrating for us is if we get a mishmash and a hodgepodge of symptoms that there's no correlation with anything and it's just a laundry list. It's like giving me your laundry list. That's not going to help me any. I need to know what causes things and when it happens and what things you can identify it with. And then hopefully your doctor will be willing to take that list and try and use it to help figure things out.
That's a great tip. So basically, prepare for your appointment, put those thoughts to paper, try to get them chronological, try to remember why something didn't work or what the experience was with it, so that you can then go through that really efficiently.
And as an adult, again, to become allergic at age 50, I'm not telling you that it doesn't happen. I'm just telling you that it doesn't happen very often. So it's almost always something else that's causing your symptoms, but allergy is like the great black hole in medicine. Oh, it must be an allergy. And it's like, no, there's other reasons why things happen other than it's an allergy. So just be open-minded to the fact that foods and pollens and pets, they don't really cause allergies when you're 60 or 70 years old. Usually it's something else.
Awesome.
Is that helpful?
Great. It's very helpful. I have a thank you gift for you today.
A thank you gift.
Yes.
Uh-oh.
So, thank you for bringing in your special mug, and I wanted to add to your special mug collection. So I'm going to gift you with a KC or Kusler Compounding Pharmacy. And these are handmade pottery mugs. We had them done for our staff, so you get to be our first person in the community to have this brand new mug as well to take home with you. Yeah.
Wow. Dawn and I have been laughing about doing this for
Weeks.
I don't know. I think it's months.
Probably.
How are we going to do this without just cracking up and laughing?
We were pretty good today.
It worked out better than I thought. I thought we'd do our usual divergence and just go crazy after 5 minutes.
Yeah, well, I'll close this up, but thank you very much, Dr. McBride, for spending the morning with me on this podcast and sharing all of your valuable information. Yeah. It's always a joy to talk with you. I knew that you would be my perfect first guest. And so, as I think we mentioned at the beginning, that
Let's hope I'm not your last guest.
Let's hope you're not my last, I know. But if patients did want to reach out, learn more, of course, you could be found at Everett Clinic in Everett. I can be found at Kusler's or Clark's in Snohomish and Bellevue. It's fabulous to have you here today. And that's all we have today. So thank you so much for listening. If you love this content, be sure to subscribe to our channel. Give us a like on this episode. Share it with your friends. And stay tuned. There's going to be more episodes to come. I'm excited to have my next guest on here shortly and talk to you then. Take care.
Your own version of Netflix. Dawn's Pharmacy Flix.
Oh, God.